Why do we tolerate discrimination against those with opioid use disorder? This question is critical in understanding how our healthcare system can better serve vulnerable populations. Imagine starting your day with the hope of finally discharging a patient after 154 days. There's a sense of satisfaction, yet sometimes it turns into frustration. A new patient, one among many admitted due to complications from opioid use, faces discharge dilemmas because of his medication. Consider the tale of a young man, a survivor of the opioid epidemic. His medical journey intertwined not just with illness but with stigma. Homeless and uninsured, he found himself in a hospital bed battling cellulitis and pain. Methadone was prescribed, a lifeline, according to medical wisdom, but it became his roadblock. No skilled nursing facility was willing to accept him simply because he was on methadone. As healthcare professionals, we're under pressure to free up hospital beds. Yet, how do we responsibly discharge someone to an unsupported environment? Despite crafting a detailed discharge plan involving shelters and clinics, the system failed. The words of the patient linger. They just don't want me because of the methadone. His experience highlights the systemic barriers faced by patients on medications for opioid use disorder. The opioid epidemic has surged, leading to a rise in hospitalizations. This, in turn, has increased the demand for post-acute care. Yet, facilities turning away patients on methadone or suboxone is not unusual. This practice not only violates the Americans with Disabilities Act and other federal regulations, but also speaks volumes about the pervasive stigma against substance use disorders. Stigma seeps into every aspect of care, from clinical decision-making to discharge planning. It leads to prolonged hospital stays and compels patients to leave against medical advice. The root causes are multifaceted: lack of education on medications for opioid use disorder, regulatory hurdles, and unfamiliarity with the law. These challenges are compounded by insufficient addiction medicine training among healthcare providers. Efforts to eliminate these barriers have begun. Recent regulatory changes, like the DEA removing the X waiver for buprenorphine, and innovative programs in states like Rhode Island, show promise. Still, much remains to be done. Expanding these reforms nationwide could mean patients with opioid use disorder are finally met with equitable, empathetic care. Reflecting on the young man's story, we are reminded of the potential difference acceptance could make in a life. What more needs to be achieved to ensure that patients with opioid use disorder receive fair treatment? As we contemplate this, let's strive for a healthcare system free from the chains of stigma and full of compassion for all who need it.